Hey everyone, happy Wednesday, hump day. We're almost to um, the end of the week, so that is awesome. If you are joining me live tonight, you guys know that I love it when you comment live, and if you're watching a replay, comment replay for me so I can know who is here with me, because it doesn't always show me who's on. It just shows me a little eyeball with the number. So, thank you all for joining me tonight. For those new to the group, I'm Dr. Monica Tillett, physical therapist and owner of New Direction Rehabilitation and Wellness, and just looking to help seniors improve their balance and educate on all things balance related. So I feel like we as people, not just aging adults, but we as people do better when we know better. So knowing a little bit behind why things happen is, I think, really important for rehabilitation and just life in general. Hey, Mom, thanks for watching. So, as those of you who are joining on, if you can also comment for me, other than live or replay, if you have diabetes, and if you don't mind sharing with the group, if you have diabetes, and that way, if you have any specific questions, you can ask them in the comments, and I can address those questions. So, let's talk about diabetes. We've all heard the word. Sometimes people even call it the sugar. It's the same thing. It is basically when the blood sugars are really elevated and your body isn't able to process, you know, the blood sugars the way that it needs to be to get it back down to the normal range. So, with diabetes, if it is uncontrolled, meaning that your blood sugars are always high, and over a course of years, it could cause some lasting damage to your body that could cause falls. And that's basically what we are going to talk about tonight, are the physical impairments caused by diabetes that can cause unsteadiness and falls. So, one interesting fact that I found as I was researching, and just looking for updated information, is that people who are 65 and over are at a 17 time more likely to fall than someone who is younger, and doesn't have diabetes. So, 17 times more doesn't sound like a lot until you are in that vulnerable category of 65 and over. You do have multiple diagnoses like osteoporosis, and maybe you've had a hip fracture and surgeries. And when you add 17%, in addition to everything else that might be going on in your body and affecting older adults, then that's a lot. And so you want to take it serious. And so there's two types of diabetes. You hear a lot about the type 2 diabetes, which is what most people have. They're overweight, they're not exercising. And so, like I said earlier, your cells fail to respond appropriately, to get the blood sugars down. But then you'll have type 1 diabetes, where people who are born with, insulin problems, and their pancreas doesn't produce enough insulin. So those are people who were just born with it. And then you have some pregnant mothers who develop gestational diabetes. And so that happens during pregnancy. But what is it about diabetes that can cause falls? Well, with the blood sugars being uncontrolled, like I said, for a long period of time, it could cause vision changes. And so, depending on how long that goes uncontrolled, the vision changes could be temporary or it could be permanent. And so, vision accounts for, I think it's 10% of our balance. It's anywhere from 10 to 20% of our balance. So, if you're cutting out the vision, that's an automatic 10 to 20%. And then if you add on something else like muscle weakness or surgeries and that sort of thing, again, that just makes that fallen risk higher. um, diabetic neuropathy. We've heard of that, and what that is that sometimes people with diabetes start to develop that numbness and tingling down in the feet. It starts, in the toes and in the foot, and then with time it works its way up your legs. Again, if you've had diabetes for years and years, these are things that can come as a result of that. And then also with diabetics, if they get wounds, it takes those wounds longer to heal. So if you have wounds that aren't healing, then you've heard of amputations. Those diabetics have to get amputations, and then, whether it's one toe, a couple of toes, or sometimes in some cases, the whole foot or part of the leg, then that is going to cause balance challenges. And let me go back to the diabetic neuropathy. If I mean, we all felt numbness and tingling, but with the numbness and tingling, at times when it gets worse, it the numbness is what really starts to cause the balance problems, because you're not feeling your feet, you're not feeling where your feet are when you're walking, and that's what could cause the falls, because you might think you're picking up your foot high enough and you're not, you're actually dragging it. So I just wanted to make sure I say that. I don't think I said it before. And then the last thing that diabetes can cause is that muscle atrophy in those lower muscles of the leg and the foot. And so, those of you who've been following my balance classes, you know that we do a lot of strengthening in those classes, including those muscles down at the ankle, because we need them especially to help us stay upright. And so, with those muscles more prone to atrophy, that's why people with diabetes could be more prone to muscle weakness. Okay. All right. So, how do we treat it? Me, as a physical therapist, cannot treat diabetes. That is something that you have to go to your doctor. They have to run tests and see where your levels are, and then determine what's going to be the most appropriate course of action, whether it's going to be medications, whether it's going to be just diet restrictions. But either way, they're going to determine some form of treatment, which is going to result in a lifestyle change as far as nutrition and exercise. But we, as physical therapists, what we do is help combat, that muscle weakness. If you are having vision problems, we help with modifying the environment. If you are having that numbness and tingling and pain in the lower leg, although there is nothing that we can do for that, the exercise and improving the circulation through exercise of the legs can help take away some of the feeling that you're having and discomfort that you're having. But again, it's not a lot that we can do for that. So we are pretty much trying to manage the symptoms as much as possible, but there isn't much that we can do outside of those boundaries. Um, and again, anyone watching, I see Mom is watching. I know she doesn't have diabetes, but if anyone watching the replay has diabetes, just please make sure you comment below, if you don't mind others knowing. And then two, I would love for you to comment, what have been your challenges with diabetes. And if there's any way that I can help you or give suggestions, I'll do that. Or if there's any one that I need to refer you to, like a nutritionist or something like that, to get the answers that you're looking for, then I can do that too. So, again, thanks for watching, and I hope you have a great rest of the evening. I hope this was helpful. And even if you don't have diabetes and if you have questions, you feel free to comment, and I will definitely answer your question. Thanks, and have a good evening.